once again we are back on Boond Soch Tea Talk Train of and Thoughts with a series of an episode with Dr. Souza, one of the very well renowned ENT surgeon based in Mumbai and practicing since 1988. And we have seen his journey, what he wanted to do, what was his passion all about, and during that tough time, his books on head and neck cancer care in pandemic and the challenges in the pandemic. We have seen this story in our earlier episodes which are there. Now, in this episode, we are going to take one by, because when we talk in terms of an important organs of a body is an ear, nose and the throat like. Now, we'll just take one at a time. So, we'll take first the nose and what are the symptoms which are there as for the nose which are concerned like. So, what are the things which can cause a nose problem?
The things that can cause a nose problem is, one, if the bone of the nose, which is known as the septum, which divides the nasal cavity into the right side and the left side, if that is twisted, then it can cause a blocked nose. This is a very common and frequent symptom. The other symptom is sneezing. This is caused by an allergy, most probably due to dust and the like. So that will, patients come and present, say that I wake up in the morning sneezing and I have a whole lot of sneezes and my eyes start to water, I can't function. So we have to look at that. The other thing are tumors. A person is bleeding from the nose. A person is swelling in the nose. These are becoming all too common, and we get a little alarmed at that because there is obviously something there that is triggering it off. We need to identify that quickly so that people do not suffer from that. The common thing is tobacco, smoking, and I've seen it proven time and again that smoking is definitely a carcinogen. It has been shown that at the age of 20, if you smoke just one cigarette a day, by the time you reach the age of 60, that means a 40-year period, you're definitely going to head towards a cancer, a stroke, or a heart attack. Most probably, it's going to be a cancer. So smoking is one habit which should be stopped immediately. There's no question but gradually reducing it, because it never happens. It has to be stopped immediately.
I think this platform of Tea Talk, Boond Soch seem to how best we can give it back to society. Professionals like Dr. Souza, like coming and sharing that what we should not do. As he has said, smoking is an injurious to health which can cause an cancer. So I think we should just try and take this as a warning, sir. So what are the infection which affects the nose?
The infections, people will get sinusitis, or what now ENT refer to as rhinosinusitis. Rhinosinusitis means that the lining of the nose and the sinuses get infected. This can result in pain, in fever, and in a discharge. But this is usually because of being exposed to germs. The person's immunity is down. The germs invade the system and cause an infection.
Nice. So how this nose problem can be solved like?
The problem of the nose is, one, what we tell people, stop smoking, because it has been shown that a person who smokes is 10 times more susceptible to an infection than a person who does not. Now, persons who, one of the reasons why we wear masks these days is that people who have a virus or infection, if they sneeze or cough into your face, you are likely to get that infection from that person. So it's important, if you have an infection, take timely treatment, cover your face so you do not pose a danger to somebody else.
Okay. So is this a sinus disease serious?
It can be. One of the factors that people that often go unrecognized, if the person suffers from a problem where their immunity is affected. So diabetes is one such problem. A lot of people who are diabetics, their blood sugar levels are not controlled. So this acts as a nidus of infection. The germs use that sugar to immediately expand, invade, and cause a problem. So people who are diabetics especially need to take care.
Okay. And sir, can you get infection in a nose?
Yes, I see this every day. A lot of people who scratch their nose or they try to dig their noses, they get a very serious infection which can be life-threatening. It can go directly into the brain. So these people need to avoid putting their fingers inside their nose and trying to clean it.
Okay. So what are the main diseases of a nasal?
Of the nasal cavity,
Yeah.
the main diseases are what we see: rhinosinusitis, polyposis, allergy, and problems related to smoking.
So this was Dr. Chris D'Souza on T-Talk platform. It's an exclusive insights what we're getting from Dr. Chris on T-Talk ek Boond Soch ki. He had given various insights for a target audience about how to take care of and one of an important organ of your body, that is a nose. So please catch up with Dr. Chris D'Souza in our coming episode. We'll be talking to him as far as the throat which is concerned. So if you like Dr. Chris D'Souza, just go to www.ttalk.net, subscribe and like the channel as much as you can. Thank you very much. So thanks a lot for inviting me.
Thank you, sir.
Thanks.